next thing is we need to talk about physicians, because remember, we talked about hospitals being a good source of referrals. So are physicians. But what kind of physicians do you want to be looking for? Remember, you need to be able to look into and ask the questions on who are good referral sources. Now, if you're not providing pediatric care or pediatric home health, then you're not going to market to a pediatrician, are you? Of course not. So, geriatric physicians are very good sources of being able to find patients from. And what you can do is you can actually do a search online to find out the geriatric patients in your area. So by you doing that search, you can actually find out who offers services to them. You can either work in the affluent areas or non-affluent areas. It does not matter. Of course, if you're just dealing with home care and non-medical services, then of course you want to be able to go to areas that can actually use your services. So go online, do a search by Google. There's also companies that can actually do a full pull-up of listings. Of course, you would have to pay extra for these type of information. One great information site is A Place for Mom. They have a listing services that you can purchase names from them. You can literally do the search by zip code, by name, by service area. Very much good information to be able to have. Also, go through your current clients. If you have clients right now, do you know the name of their doctors? Get those names and target them and market to them directly. You're not just going to call them for approval for patient information just for that patient you're taking care of. See if you can get more referrals. If they're enjoying the care that you're providing their clients, their current clients that you're caring for right now, then potentially they're going to enjoy your services for other clients that they have that they will refer to you. So go through your current clients and do that. Research who are referring to home care. Look, if you are in this industry, you're going to know other people, other companies. You're going to hear the talks. Find out who are referring to the home care, who are referring in your area that you can actually maybe get to go to your site and start referring to you as well. Find out these people and find out, who they are supporting. Are they supporting certain news information? Are they supporting certain associations? Okay. How do you find this out? Well, if you know a particular physician, see if you can find their Facebook account. See if you can look into their LinkedIn account. And if you're able to do that, and yes, it's kind of creepy, you may say, or you might say it's stalking, but not really. Look, if they put it out there, those are informations that you can definitely use to your advantage. Find that common ground, find that common interest, and use it. Take advantage of it, because that can help you build rapport with them. So also, other than the geriatricians, you need to look at other physicians with specialty practices, and that they work with chronically ill diseases related to aging. So for specialties, look into the neurologists, rheumatologists, cardiologists, thoracic surgeons, and also geriatricians. So let's say, for example, you can look into Coumadin clinics, great sources for patients. For disease types, look for physicians that are working with Parkinson's disease, with stroke, with Alzheimer's, COPD, and cardiac issues. If you're not familiar what COPD is, that's chronic obstructive pulmonary disease. But if you are going to be working in this industry as a marketer, as a liaison, you need to be able to look at what are the top diagnoses that patients are normally having when they're receiving services from home health and home care agencies.